All attendees are in listen-only mode.
Hello, everyone, and welcome to today's SNRS webinar. I'm Jennifer Lanfear, the Account Coordinator for SNRS, and we're pleased that you could join us today. Before we get started and hear from our distinguished speaker, you'll be seeing the SNRS splash screen while I go over a few housekeeping items. Your phone will be muted automatically in consideration of our presenter and your fellow webinar participants. Please use the chat feature set to organizers and panelists only to send in your questions, or if you need to let us know that you're having technical difficulties. All questions will be saved until after the panelist has spoken. At the conclusion of today's presentation, you'll receive a webinar evaluation via email. We encourage you to provide feedback so we can continually improve the SNRS webinar program. You will also receive a link via email to the recorded broadcast of this webinar and to the slides. Our moderator today is Dr. Lynn Andrus from the Seton Healthcare family, and Dr. Lynn is an RN navigator and adjunct faculty at the South University in Austin. I'm going to turn the webinar over to Lynn so she can introduce our panelists and get us underway. Lynn, would you unmute yourself and introduce Christy, please?
Sure. This is Lynn. Before I introduce Christy, if you don't mind meeting for 1 minute, I'd like to just welcome everybody to our Health Systems and Health Policy Research Interest Group. We're a new, reinvigorated group, and so I'm so glad to see people attending. I'd also like to do a shout out to Dr. Michael Carey, Assistant Professor at the Duke University School of Nursing, who has applied and is in the process of looking at co-lead for our RIG. With that, I'd like to introduce Christy. She is my own Vice President for Innovation and Virtual Care at Seton Healthcare Family. That's where I'm an RN navigator. We are in Central Texas, which is part of the not-for-profit Ascension Health healthcare family. I find Christy both a visionary and a realist, and also very engaging. I think you'll enjoy this seminar. I'm not going to read everything because she's got such a great bio, but I do want to mention that she is a DNP, as well as the credentials of CFNP, CACNP, FAAN, and FAEN. But she's also recognized for successfully increasing access to high-quality, low-cost health care for thousands of patients through virtual care models such as telehealth, which she pioneered in Mississippi and now is in Texas. She received her doctorate of nursing practice from the University of Alabama at Birmingham, and she maintains those national certifications as a family and acute care nurse practitioner. I think I'll refer you to all her different testifying. But I'm excited that she's been has talked at South by Southwest, also TED Talks, as well as testified in front of the United States Senate Committee on Commerce, Science, and Transportation on advancing telehealth through connectivity. Her accomplishments includes Robert Wood Johnson Nurse Executive Fellow, the 2015 Mississippi's 50 Leading Businesswomen, and a 2014 Nurse Innovator of the Year. So with that, this is about Christy. I'm going to turn it over to you, Christy. Thank you.
Christy, that looks perfect. You're in slideshow mode, but we aren't able to hear you. Seems like for some reason we've lost your audio.
That's surprising because in the test run, you came out very clear.
And we were connected earlier.
It
sounds like she is just going to call back in. So please be patient while we get started in just 1 more minute.
So with that, did you mention how to ask questions and review that with the attendees, Jennifer?
I did. They can ask questions through the chat feature set to organizers and panelists only. So please do send in your questions during the presentation so that we can review those and get those over to Christy right away after the presentation. Please don't wait till the presentation is end. Thank you all for your patience while we just get the audio portion figured out. Hi, Christy. Have you connected?
Hey,
Perfect.
I just added, good. I just added it on my phone since the computer decided to quit working.
Okay.
So
Perfect.
so sorry about that. Thank you for having me, first of all. I'm always excited to talk about all things digital health and how that's impacting nursing. So thank you, Lynn, for the invitation, and to SNRS for hosting this event. So I'm going to spend a little time at the beginning just talking about what telehealth is and kind of a level setting of what's going on nationally. And so you will hear a lot of exciting things going on, some of them scary, some of them ones that you may all have witnessed firsthand, but it's an exciting time in healthcare, full of rapid change. So I'll review the state of telehealth and those trends and what it means for patient care, and even some of the limitations that we're finding in deploying this and around future adoption. But then really I'm going to spend the last portion of the talk focused on what the literature is showing, what are the research gaps, and what does this mean for nursing, and how can we engage in this important change in healthcare. So that's where I'll focus it, but I'll leave time at the end for questions as well. So there's a lot of terms being used for telehealth, everything from digital health to e-health, telemedicine, virtual care, on-demand care. It goes on and on, and it's led to a lot of confusion in the healthcare space on what really telemedicine or telehealth is. So I'm going to just kind of start with a broad definition and kind of clarify some terminologies that I hope will be very helpful. But know that that's one of the challenges, and when you look at research, is that these terms are not defined in a standardized way. And so are we comparing apples to apples, or are we comparing two different modalities? And so American Telemedicine is a national association that, that really represents the largest number of participants in the use of digital health or technology for healthcare. And they've been around for over 20 years. They have a very diverse population from business to clinical to technology sectors. But they define telehealth as the delivery of patient care, consultations, and education that's supported by telecommunications. And it goes into a little bit more around how that can happen, which I pulled out and into the box below that. But it's important because it's really just about delivery of healthcare services, all the things that we do in a traditional hospital or clinic, or even in home health, or any arena of healthcare where nursing is involved, and how can we change the modality of how we deliver that service using technology. And so telemedicine is usually reserved around the true medical or clinical services where there is a provider delivering care. So that could be an advanced practice nurse, that could be a physician, it could be several different people, but it's a medical care delivered. But is often called virtual visits, e-visits, or even just good old telemedicine in a direct-to-consumer application. And there's a lot going on in this space nationally. There's a lot of national companies that are not traditionally healthcare entities that have started telemedicine companies. So I'll speak to that in a minute when I kind of talk about the state of telehealth nationally. Telehealth is usually the term used to encompass more than just the medical care. So that's typically where telenursing comes in chronic disease management and care coordination. It can also include education as well. So diabetes education, group education classes, those are all being rolled under this broader term of telehealth. This becomes very important when you start talking about reimbursement as well as in policy. These terms are being used and the unintended consequence of not thinking through the use of the words is that we either create barriers or we create a gap in the policy to where it was not intended. Remote monitoring, which is one of the areas I'm most excited about, is really how do we monitor health and monitor chronic diseases, and even get ahead of that and get on the wellness side of healthcare, and use technology to do that in a smart way. And so I'll spend some time on that. But this would include things like mHealth, the use of fitness trackers and wearables, and other sensors as well. And then store and forward, this is actually one that's been going on probably the longest. Radiology, all of radiology. Most people don't think of it as telemedicine, but it is a store and forward telemedicine. There's an image taken. The radiologist is not typically interacting with the patient. They get an image with a history and they make a diagnosis. So that's where store and forward comes into play. So when you think about where things are nationally, you probably each all have different exposure to seeing the use of this actually carried out in healthcare, but it's a multi-billion-dollar industry. If you look at some of the latest reports, they're all over the place of the projections, but Becker's Hospital Review has put out one recently that projected this to be a $113 billion industry by 2025. It's active in all 50 states. Every major health system has got this as part of their strategic plan and rolling it out aggressively. Some successful and some not. And I'll speak to that in a little bit on some of the barriers or limitations. But just one good example is Kaiser has been in the news recently, and they're talking about shifting 50% of their ambulatory visits, so their clinic visits, to a telemedicine platform. And so that's important when we start thinking about training our workforce, understanding the impact and patient adoption of the use of technology. There's a lot of implications to this that I think we're still uncovering, and why the research in this space is so important. And then it's really vital to many small community hospitals and clinics where they just don't have the resources that they need and would never have the volume to support bringing those resources in. So it's, in my mind, it's really about load-bearing healthcare providers and the healthcare team to patients who may be in underserved areas, but they still need and deserve the access to care. On the right, this is really just some of the SAGR, the growth rates that you'll see for virtual care market going from 2014 up to 2019. And North America is the largest growth, but an incredible amount of growth in telemedicine and remote monitoring. And so, you know, none of this really matters unless we're able to actually impact health and lower cost of care. And so I put this up here to really have everyone appreciate the magnitude of digital health in the healthcare system and the activity that's transpiring around that related to policy, scope of practice, and all types of aspects of our delivery system. But it's really important for us to understand, so what? So what does that mean as far as the health of our country and of our patients that we serve? And so when you think about virtual care as a whole, or telehealth as a whole, in my mind, I've simplified it around quality, equity, and affordability. And if we can provide the needed health care to the right people at the right time at the right place in an affordable manner that is cost transparent, and can deliver that in a quality way that has comparable, if not better, outcomes than the traditional system, then we really have got something that will transform the healthcare system. We've come a long way with the research in this space, but quite a bit of work to be done, and I'll talk about that in a minute. But if we think about it in the lens of those three primary goals, then this is really about a modality to deliver the right care at the right time in the right place to achieve these three things. So I think that a lot of times when people think about telemedicine, they immediately think of maybe a telestroke program or a telepsychiatry program where someone in a hospital is connecting to a physician specialist. And then I would tell you that nationally and even internationally, it's much different than that. It's much broader than that, and so there's not an aspect of nursing that wouldn't be impacted by this. So even the school health nurse, home health nursing, palliative care, I can't think of a single aspect that wouldn't be touched by the use of telehealth. And so on this slide, I really wanted to emphasize where all people are delivering telemedicine. So it's not just in hospitals, it's in clinics, it's at the workplace. So businesses are providing it for their employees. It becomes the employee health program where either a click of a button on your desktop computer or connecting through an app on your smartphone, you can get access to a therapist. You can get access to a physician, nurse practitioner, or even a nurse that is helping you manage your chronic disease, or even health coaches that are motivating and encouraging you through chronic disease management. Schools and colleges are a great location, nursing homes and assisted living, and I could speak to each one of these for probably 30 minutes, but when you think about the challenges in a nursing home and what typically happens after hours is that residents are transported to ERs for any symptoms because they don't have anyone there to do assessments. And so inevitably a senior or an elderly patient presents to an ER where they don't know this patient, and because of their age and their risk factors, they automatically get a full workup and typically are even admitted, where if the person who knew them, knew their full health and condition and medications, could have done an assessment over telemedicine in the nursing home and minimized unnecessary transports to the hospital, saving money. And I'll speak to that in some of the research in a minute. Correctional facilities, instead of 2 guards and an inmate going to their 4 times a year cardiology or endocrinology appointments or infectious disease or whatever it may be, that's now being flipped, and this is being done across the country where healthcare is being delivered by telemedicine, and only if the inmate needs to be transported for lab or test or something that we can't achieve in a quality way through telemedicine, then we're really flipping the healthcare system to bring the service to the inmates instead of having the inmates have to travel to go get it. So clearly better access to care, but also an important safety issue as well. Mobile health vans are being turned into multidisciplinary clinics that are routing around, connected by telemedicine, going to communities and connecting to services that community never had before. So very exciting things, including teledentistry, which is exciting. Shelters and group homes. So this is not something that only people with smartphones or people with access to a clinic with telemedicine can get. There are a lot of efforts being done with shelters, group homes, and even providing locations for the homeless to be able to come in and access services as well. So very interesting component of this, because it ventures into some of the most complex patients with a lot of behavioral health issues as well as substance abuse issues, that having that support group around virtually is providing a new opportunity for us to manage that population. And so why do we want to do this? And so every system that's looking at this is looking at it for different reasons. Some people have got into telemedicine because they had a shortfall of a specialty. They didn't have enough neurologists, for example, so they wanted telemedicine for that. Some places have said, you know, I want to do telemedicine because I need to coordinate services better and prevent readmissions. And so when the patient leaves the hospital, how can I manage this population or these patients that are at risk better outside of our hospital and extend our services? And those all are very valid reasons. I would say the most sophisticated health systems that are rolling this out are looking at it more broadly than that, around improving access for their customers, improving the outcomes, and so that includes additional support in the home and readmission prevention and access to specialists that were once not available or delayed because they didn't have the capacity, but the telemedicine fills that void. But my favorite area of this is because most people think that telemedicine is very cold and that you lose that human touch, that if done correctly, that you can actually standardize and personalize at the same time in a way that we're not able to do in a healthcare system. So a good example is we have the ability to not only bring in translators, but providers that can be more culturally aware and can share the same cultural background as our patients if the patient's more comfortable with that as well. So we have ability to adjust also for hearing or vision impairment, so that I can make everything on the screen audio, or I could make it bold, or I could adjust for color blindness. I can do all kinds of things real time through technology that in many cases I can't adjust for quickly in a healthcare system. So systems are looking at this in a much broader sense around improving healthcare and lowering costs, but really it's about the quadruple aim, and this is a new opportunity for us to redesign healthcare. This slide is really an interesting slide that I think that is worth just pausing to let it soak in. And so this is talking about care that was traditionally provided in person, and now it's shifting to telemedicine. And so in 2015, about 2% of the traditional care had shifted to being delivered in a over telemedicine or virtual care. And if you look over and you see this progression from 2% to 7% to 17% to 22%, you can look at that in two ways. One is telemedicine is being adopted and they're using this, and we've got new ways to deliver the services we have. Or you could, if you're a healthcare administrator running a system, you could say, if my health system isn't offering this to patients, then the patients are going to go to a more convenient method that another health system is going to offer. And so when you start looking at the market, there are companies, Google, Amazon, Apple, and I could name more and more that are getting into healthcare, into the space that was traditionally managed by a hospital, Walmart, I can go on and on, Ready Clinic. They're all now offering telemedicine services, and so the competition has increased and the consumer has a stronger voice now in how they want healthcare to work. And this slide to me is an important one to start reflecting what will happen in our clinics and our hospitals over the coming years. Okay, so it's not a rose garden though, and there are a lot of health systems that are trying to do this, but they can't find the financial stability in the model. And so there's a challenge with adoption. It's no different in my mind than when we tried to roll out the electronic medical record. There was a ton of pushback. No one wanted to change, and there continues to be a lot of pushback. And so anytime you're changing workflow, changing how people do their job on a day-to-day basis, you have challenges with that. So that's one. Some of that's because there is still a lack of confidence in some that they're able to meet the same clinical standard, and then many think that patients prefer in-person care. There's quite a number of surveys out there that patients want convenient, affordable health care and would change their provider to a provider that offered telemedicine if they could have it more convenient, that it was not about the in-person care. Now, that is different by age groups, but in general, adoption continues to be a barrier and a limiting factor in the full deployment and integration of telemedicine. We're talking about delivering healthcare from a distance, and so there's a lot of places that want to deliver it across state lines. If my patient goes out of town and now they could access me through their mobile app, what are the regulatory and licensure impacts of this? And so there's a lot of work being done by nursing as well as medicine and pharmacy at the national level on regulations and around licensure issues. This is where the compact license for nursing will be very important. Integration continues to be a challenge, and so to prevent this being just another burdensome system that the nursing staff have to figure out how to access when they need it, it's got to be integrated operationally to the electronic medical record, and it needs to be convenient and easy for patients as well as the healthcare team, and so that continues to be a challenge. Patients are learning about this and demanding it, but there still has been a slow increase in adoption, mainly because their physicians or healthcare team where they normally go don't have the access yet and aren't pushing it from their end. But we are seeing more and more demand from the consumer or our patients to have to offer telemedicine. And then change is just not easy. That's the bottom line. And anytime that happens, there's a lot of concern, and rightfully so. We need to do the due diligence and study this to understand where it's appropriate and where it's not appropriate. And I'll talk about that in the research in a minute. So the next few slides, I'm going to kind of give you an overview very quickly of telemedicine and the main modalities of how people are delivering healthcare through technology. These are ones from my program here, but they are translated easily to any other health system. This is typically how most hospitals look at this. So 3 modalities: telemedicine, digital clinics, or remote monitoring. So when you think about telemedicine, this is the traditional telemedicine cart that you typically see in a hospital or a clinic, and it allows for devices to be plugged into it. So stethoscopes, otoscopes, and other devices, so that you can replicate the clinical exam from a distance. And so there is somebody with the patient that is basically serving as a telepresenter usually, and they are putting the stethoscope on the patient, putting the otoscope in the ear, all of those good things, and helping to facilitate the assessment that's being done by the provider. In this case, let's say the nurse practitioner on the other side. So the nurse practitioner is doing that assessment through the screen, but still able to listen to heart and lungs, still able to look in ears, assess the skin, all kinds of things, because the devices have gotten very sophisticated that can be attached to this equipment. So exciting possibilities around what that means for access to our providers. In our area, I've looked at it around being able to connect, being able to coordinate, and being able to optimize. And so this is just a depiction of our community and some of our partners. But one of the biggest risks in the healthcare system is the handoff between facilities, between care teams, and frankly, some locations have different services than others. But telemedicine allows us to balance that and offer same services. Some of it's through telemedicine in one location, some in person in another, but it allows us to be very consistent and more equitable about our offerings to our population. When you think about the digital clinic, this is the one where that's being deployed often for employees in an employer or location, or for students at school, but it really can be for any specialty to extend their office. So instead of bringing in follow-ups to your clinic, or maybe even delaying care because somebody can't come in, you now have an option to be able to do some lower acuity interventions and assessments through a mobile app. So ours is called Good Health. We have a digital app, and for members that are in our program, they can access us 24 hours a day and see one of our healthcare providers who can, in many cases, complete the visit, in meaning that they can diagnose, prescribe, and treat so that someone doesn't even have to come into the clinic. So these are for your coughs and colds and flu seasons and rashes and pink eyes and things like that, low acuity, but a very nice offering for us to be able to extend our services so that you don't have to come in for those minor ailments to a very expensive clinic, urgent care center, or worst case, emergency room. And so we're always open, and most health systems have done this. They've provided some other venue for healthcare outside of an ER 24 hours a day at a lower cost, where you can be connected to our services in your home, in your workplace, or on the go. And we consistently are seeing good health outcomes from the use of this nationally, and more uses of this. I mentioned chronic disease management or remote patient monitoring early. This is a kit that we use, and this is really about extending the ability to have visibility into a patient's health outside of our hospitals and clinics. And so those patients that are at high risk, we can support them through education, monitoring of health, and really be their lifeline on an ongoing basis outside of the hospital. And so all the information that comes from the vital signs that we're monitoring, as well as how they answer questions on a tablet. You may have seen on that last picture that the kit had a tablet and it had devices, and so it's customized to the person. Well, if I'm a heart failure patient, I'm having my weight and my blood pressure monitored, all of that information is populating into a dashboard where our remote monitoring nurses are able to then see a very large population and see where there's somebody that they need to intervene on. Instead of being reactive, they're being very proactive to say things like, I see that your weight has gone up a half a pound today. Let's talk and let's see what's going on. What did you have to eat? Did you take your medicines? And so wrapping around services that include nursing, social work, health promoters and coaches, pharmacy, as well as dietitians, really create a nice offering for patients to slowly be empowered to manage their own health, but for us to also just really support them during those most at-risk and vulnerable times. So we're building a smart care network, and that this team is able to then, through all of these dashboards, monitor populations within our hospital, outside of our hospital, and really do true population health. So it's an exciting time. So let's talk a little bit about the research in the next few minutes. So there's about 40 years of research in telemedicine and telehealth. And if you looked in 2015 in PubMed, it held over 12,000 citations related to telehealth and telemedicine. And in one journal that's devoted to telemedicine solely, there was over 2,000 evaluative studies. Primarily, the research has been focused on cost effectiveness, quality of care, and patient acceptance. However, there is still quite a large gap in what we need to be studying. But I want to highlight just some of these areas that I mentioned around quality and cost and efficiency with the use of it. These are just a few studies that are out there, but I think they really start highlighting some of the opportunity that nursing has to continue their research and to expand on these to make them more robust and transferable. But if you look at a project with CMS, the Health Buddy program, this was an important project that was looking at heart failure, diabetes, and COPD. They were able to reduce spending anywhere from a little over 7% to just over 13% over 2 years. And CMS has been over probably the last 5 years, but a lot through their innovation center, has really been focusing on value models and telehealth and others around how do we really control costs and still have the outcomes that we need. And this is one study that helps to do that. North Carolina has a telehealth network, and they did an analysis around the impact of their telehealth network as a whole. And they looked at their bed days, their ER visits, and their total hospital costs related to the population that was using telehealth compared to those that were not. And as you can see, huge reductions, again, in the days and use of the system. What's interesting about this is if you think about it, we're still in a fee-for-service healthcare system. So if you reduce that too much, it's actually a negative financial impact on the hospital. If you're in a value-based contract where you're actually benefiting financially for a healthier population, then this would be ideal. So that's one of those other limitations that's worth noting here, is that we're moving the needle and changing a model of care before the reimbursement model has completely changed with it. So one that all the health systems are very sensitive to. When you look at readmission prevention, which all of us are really keen on now, especially because of the penalties, sadly that had to be the impetus. But there's study after study, and here's just a few to highlight that. Ascension Health and St. Vincent's had a 75% reduction in hospital admissions and a 5% overall readmission rate, and the national average is 20%. The VA has a large home telehealth program. They were able to reduce number of inpatient bed days by 25%, and their reduction in readmissions was 19%. Again, you'll see two other ones where you see these reduced readmissions and reduction in length of stay. The one I was involved in was the bottom one, which was working with our Medicaid office. We deployed a telemedicine home monitoring for uncontrolled diabetics. We were able to show about a $3,300 a year savings in cost to Medicaid. And when they did the projections on what that would have meant for their entire Medicaid population that was diabetic, this was in a southern state with a high diabetes prevalence, they projected $189 million a year in savings. And because of that study alone, the governor signed into a law mandating reimbursement of this program by all payers, public and private, in the state. So a huge win, all based on a research study that was very focused on telehealth as the modality to manage chronic disease in diabetics in a high-risk population. When you look at nursing homes that I talked about earlier, the opportunity from avoiding ER costs, avoiding the cost of the transportation by ambulance from a nursing home to the ER, the transportation to clinic visits, not to mention it's extremely disorienting and puts the nursing home residents at risk by exposing them to people that are in clinics that actually do have an active contagious illness. By changing the model and bringing the healthcare to them, you really have the ability to minimize those negative impacts on seniors. And so there's numbers there. I won't read all that to you, but extremely important when we think about we are all under increasing pressures to minimize the cost of healthcare. And these are just a few studies that are starting to show that. But for us to be able to truly integrate telehealth, we've got to be able to show the value proposition and to understand the balance of in-person care and virtual care, which is where the research continues to lack. When we look at some of the research that's been done on diabetes and behavioral health, there have been studies done that are consistently showing that among patients with diabetes, the use of behavioral telehealth services significantly decreased the depression, anxiety, stress, and ultimately the glucose levels. And I think we've all recognized that our lack of or inadequate telebehavioral health services to support patients with both medical and behavioral health issues is lacking. But telehealth can be a way for us to enhance that where we had a shortfall from the workforce and just the ability for us to even achieve that in a traditional model. We now have a better ability through telemedicine. When you look at telemental health in general, because I think this is an extremely important area in healthcare, there was a study done and they looked at 59 different studies between 2005 and 2015, and consistently all of those showed that telemental health actually allowed both an impact on cost and clinical efficacy. And so this was done across multiple different populations, from pediatric, nursing home, VA, non-urgent uses, and even related to stress and military. So the studies are starting to show some significant impact to give us the justification and impetus to be able to implement this in a broader way. I'm actually involved in a National Quality Forum work group around measured development for telehealth because one of the challenges in the studies and understanding the impact is that we don't have a measurement framework. And so this is just some draft work that we're continuing to work on, but we did an environmental scan of all the literature. This was done and hosted by National Quality Forum, and there's a group of about 15 of us or so that are on the work group. But we went through just enormous amounts of information and lit review to be able to look at where do we need to where's there a gap in the measurements that are out there. And clearly y'all know that these measurements often end up being what CMS uses to set reimbursement or even penalties around it. So the committee is not taking this lightly. We understand the magnitude of this, but it's important for us to start being able to understand the impact from telehealth. And so that we put into domains around access to care, cost, the cost effectiveness, the patient experience, and the clinician's experience. And we worked on defining that. But then we also then took all the articles that we reviewed and put them into what modality they were used, and then in what category did those articles from the environmental scan cross over into, so that we could support it to look to see if there were already measures that existed or if we need to create new measures. And so this work continues. It will go on through the fall of this year. And so we have a pretty long journey that we've been working on to make a recommendation about the measurement framework. So gaps in the literature, you know, I want to, before I go into this slide, I want to just touch on, and I've only got about 5 minutes and then we'll go to questions, but I wanted to just kind of emphasize in my mind where the gap really lies, because there's so many areas of opportunity for research for nursing. but we're really talking about transforming how nursing does their job and how we interact with patients and how patients interact with us. And so while there is research that's showing cost reductions and that we can have comparable outcomes as in-person, we don't know the balance of all this and the long-term impact of that. And so AHRQ actually funded a conference, and it was all focused on this to create a national telehealth nursing research agenda. And there continues to be nursing SIG groups that are focused on this as well. But what has been consistently identified across this environment is that there needed to be an increase in studies where there was a clearly identified population, standard outcomes, and standard methodologies to support the cost effectiveness of telehealth. And that includes the issue that we talked about at the beginning. There's not even standard definitions, and there has been typically more of all the studies that are out there, they're typically very descriptive studies of a program or a pilot project that was implemented, and not true experimental studies that are able for us to translate that to the impact that it would have and how it applies to all of us nationally. So there continues to be a need for more studies and more in-depth ones and multi-site studies as well to get the volume that we need. We talked a little bit about the standardization. But we need to understand what the balance of this is and what parts of nursing can be translated into telehealth safely. And so, and I say that because I don't want us to limit this to thinking about how can I do my job in the hospital or in the clinic using technology, but also to even think about how can I use technology to help me do my focus my skill sets on the things where I need to spend time. So I just started doing some research with robots in the hospital. And the whole goal was not to replace people's jobs, but to recognize how valuable the time is when the patient can actually spend with the patient instead of running to get supplies, paging people, doing all those non-clinical tasks that we oftentimes, because of reductions and tightening in the healthcare system, a lot of those additional support staff have been removed. And so the burden on the nursing staff is oftentimes pretty great. And so I would say let's broaden that into thinking about how can we even utilize artificial intelligence and robotics and stuff to help nurses be able to do what they need to do as a nurse. There's been recommendations of an international state of the science conference on telehealth to really pull people together to focus on what should be our nursing research agenda in telehealth. And right now the hottest topics in research that we continue to have gaps in are around chronic disease management, patient empowerment, and enhanced self-care. So I did a presentation at South by Southwest not too long ago this year, and that was the whole focus. When does somebody really need to go into a clinic or see somebody, a clinician, and how much can they do on their own? And consumers are wanting to be more engaged, so that'll be an interesting area. And then also around how can we really support multidisciplinary care using telehealth now that we can connect people from multiple locations, and instantaneously at the bedside I could have a multidisciplinary team instead of people traveling or running up and down the stairs or whatever it may take to achieve that, so that you have a more efficient system so that you can focus on what you need to be focused on. So I wanted one slide just to kind of talk about the future, and then I'm going to open it to questions as I committed to, and really sky's the limit on the questions. If I don't know, I'll advise, but I'm very passionate about this area, so I'll welcome any question, even if I haven't touched on it. So what's ahead is really we have what I would call Population Health 2.0. We're taking what should have been a coordinated system of care, and now through telehealth have the ability to really transform across an entire continuum and connect groups that typically had challenges communicating to create a more cohesive system. Consumerism is going to change how we do healthcare. Consumers are demanding, they're searching out for cost transparency, they're demanding more convenient, accessible care. And traditionally, we've all been very slow to respond to that, but market share is impacting health systems, and now they're listening to customers, which means we'll have to change how we respond and how nursing is involved. The wearable technology and sensor movement is unbelievable, and so what of that information are we going to trust? How do we validate that patient is who they say they are? How do we know the integrity of the data and that it's really theirs? And so, and what's useful? Do we really need to know that they walked 10,000 steps today? Probably not, but I do need to know if they normally walk 10,000 steps and then today they didn't walk at all. And so I think there's some interesting things that will transpire in that space. Smart homes, smart cars, smart care teams. It goes on and on and on. Sensors to know if somebody has increased their urination and maybe a heart failure patient, they're going to the bathroom more often. There's all kinds of home sensors to know what's going on in the health of our patients. Mobile apps are overwhelming number of them. How we get some kind of standardization and can advise patients on which to use or what's good probably needs to happen, but there's a lot of effort in there to study that space. And then the space of genomics, precision medicine, robotics, and additional technology to do diagnosis and treatment. I can do a retinopathy exam with my smartphone. I can do a breathalyzer test that's not just looking at alcohol, but clearly can do an incredible amount of analysis of volatile gases to be able to even start diagnosing things around lung cancer and other metabolic disorders that have typically gone under-detected or delayed in detection. So there's a lot of work being done in that space as well. So exciting stuff around the horizon, which creates an amazing opportunity for nursing to get involved in research in any aspect of this, whether it's an emerging technology, whether it's around an impact of the use of technology in healthcare, or even around the workforce and training that needs to be associated with this. There is no shortage of opportunity here and continues to be an opportunity and call for action for us to get involved. So I think I've allowed 12 minutes instead of 15 for some questions. So I will pause there and turn it back over, Lynn, to you. Thank you.
Thank you, Christy. I enjoyed that. If I'll ask Jennifer. Jennifer, could you remind people how they can ask questions? And then I've got a couple in reserve as well.
Sure. They can send in questions through the chat feature set to organizers and panelists only. So I know, Lynn, you have a couple questions for Christy. If you want to get us started, then we can field some other questions.
Excellent. Well, Christy, you answered, I had several questions coming in. You've answered 3 out of the 4 I have, and I came up with another one. You talked about the innovation research, cost-benefit research, outcomes research. Could you elaborate a little bit more about health policy research, especially in this economic and political climate?
Yeah, so let me see if I can capture it best this way. So I was presenting to the American Academy of Nurse Practitioners recently in DC at their health policy conference. And we were talking about all the policy that is federal policy that is coming forward that would impact our healthcare delivery system or would impact funding of some of this work related to access to care, digital health, all of that. And the challenge has been that there are some great studies out there, but when it comes down to what the Congressional Budget Office or a state agency wants, oftentimes we don't have the research needed to be able to show this true value proposition. About a week and a half ago, I was in Orlando at a conference for the American Telemedicine Association. One of the keynote speakers was a health economist, and her whole presentation, which was fascinating, was talking about how our research really needs to be focused on the cost side of things, because that's going to impact all of these policies and scope of practice and everything else. So there's a state and a federal side to this. At the state level, it's tended to be around scope of practice. Nursing boards are trying to figure out what, if anything, they need to write into their rules and regs around the use of telemedicine. Can telemedicine suffice when it comes to nurse practitioner collaboration? Can that count as the face-to-face visit? Because now they have immediate access. Does that change for the states that have very restrictive practices? Can that be a way to satisfy the fear that some have, which I would say unwarranted fear, that care is going to be substandard. So now through telemedicine, can we truly have a collaborative team approach? So I think that's a little bit all over there, but to say that there is a lot of need for us to be able to demonstrate how telemedicine provides that quality care and is doing so at a lower cost, instead of just saying that or putting forward studies that are too small or don't have the power that they need. We've got to start having some multidisciplinary analysis as well as multi-site analysis to be able to then take the work that I did in my previous state and be able to take it to where I am now in Texas, and it to be translated and utilized to influence policy here as well. So I think there's a lot of opportunity for all of us to be able to advocate for telemedicine to be able to be a way to deliver equitable, affordable, and scalable health care that's quality.
All right, this is Lynn again. Looks like I'm up again. How do you see the PhD and the NP, whether it's a master's or a DNP, how do you see that they best can help forward virtual health and innovation?
Well, I would say that first, in their current environment, wherever they are, whether it's in education, in research, or in clinical care, that there is an aspect important for their voice to be at the table and to be a part of integrating this in a safe way that has the lens of nursing also involved in the ultimate model of care. And that, so I think that's true in a lot of different aspects of how those different groups in nursing can be involved and how important it is. But I think that would be one. First, find out what's going on in the organization you work for. Is there an agenda for telehealth? Is there a research agenda? Is there a team that's formed as a telehealth committee or coalition at your health system or clinic or organization you work for, and get involved in that? There are quite a number of opportunities of where you can get in and start learning more about it, but also be at the table to advocate for patients and just exactly what we're good for. Really being able to be that patient advocate and bring in a very important lens into the new model of healthcare. So I wouldn't be scared of the technology. My background is clinical, and I have jumped in and feel very comfortable using it now. A lot of times people are intimidated by it, but I can assure you that when a telemedicine program is done well, it's very easy and intuitive. And that's exactly one of the things nursing needs to help us do, is we should never create a system that is more cumbersome and ineffective or costs too much, because it's not sustainable. And so I would say to jump in and make sure you're a part of creating the use case and the business plan for telehealth in your organization.
Okay, it looks like piggybacking on that question, how is the best way for faculty to help prepare nurse practitioners and other nurses to do telehealth, and what should, basically, how do we get prepared?
Yeah, no, this is probably one area that I'm most concerned about, is that we are not, most organizations and educational programs are not fully engaged in educating their students about telehealth, and rightfully so. It's not necessarily fully integrated, and every system's using it differently. But I used to be of the opinion that we needed to have a separate course. So I would go around to nursing, medical, pharmacy, dental, all those schools, and I would do guest lectures constantly just to introduce what's going on in this space, what do you need to know, and then leave planting seeds so that it could flourish and they could take it forward. Then I got to where I was working specifically with the School of Nursing in the previous state where I was in, to really integrate it into everything they were doing. And so whether it's an EMR or telehealth or whatever, it's not changing what nursing is. It's changing how we deliver it. And so really adding it into the curriculum throughout, and to give case studies and examples of, maybe you're teaching about, cardiology or women's health or whatever, but talking about scenarios where in the rural hospital, this is how they're doing telenursing, and give examples of that and start integrating it in. So students are beginning to rotate through systems where this is already integrated, and they're getting to be a part of that. I'm starting a little mini residency type program this fall where students can come into our what I'm calling our command center, where all the virtual care and call center and care coordination will all be consolidated and centralized. And I'm having rotations where people can experience it all. And so this is in partnerships with nursing schools and other schools as well. So I think it needs to be in the curriculum. I think it needs to be exposure through the clinical environment as well. And then really connecting to people for guest lectures to introduce really what's in the future.
So it looks like we have another question on that. How do we learn more? Obviously, SNRS is taking some leadership, but do you recommend like the American Telemedicine Association?
Yeah, so there's that is a great one. If you want to look at more of the policy, so the American Telemedicine Association has clinical policy, even educational, and a lot of content on their website that's free and public. There is a little bit more content, actually a pretty in-depth listserv and shared community where there's a telenursing SIG that there's if you're a member. So you can join as an individual or as an organization and get plugged in that way. The Center for Connected Health is a really good policy website that has state by state what are the laws around this. It'll talk from a reimbursement side as well as a professional organization side. So I think those are two great websites, but if you, there's a ton on the internet, probably more than you would ever want to, but those are two great dependable websites that have a lot of great resources around where you can find the latest research as well. National Quality Forum, National Councils of State Boards of Nursing is involved as well. So I think that you won't find a shortfall. It's just purposely going in, even to your own state nursing board or association's website. Many of them now have position statements or some type of link over to telehealth groups that are in your own state.
All right, last question I believe we have time for. How would you like to close? What excites you most, or what would you like to leave us as a final thought?
You know, I think that my main, if I want us to close with anything, first of all, I would hope that the group is energized and would pass the baton and the information to get more nurses involved. I've been in this space since about 1999 and am involved at a national level on this, and I continue to see an unbelievable involvement by physicians and pharmacists and others. Nursing has not joined in as quickly. There's still a lot of really good nurses and nurse practitioners all over the country that are strong advocates for telehealth and are involved in it or are working in telehealth programs. But I want us to have a more purposeful position, research agenda, and voice at the table so that nursing takes full advantage of how this could really transform how we do healthcare and improve the health of the patients that we serve. So it's really more about a call to action to really stay plugged in on this, find your way to get involved in this, whether you're in education or in healthcare or research. There is a place for you to start touching this, and so it's really a call to get involved.
Excellent. Jennifer, is there any other housekeeping issues, or is it time to wrap up?
Yeah, I'd like to do a final wrap up. Thank you so much, Lynn and Christy. And thanks to all of you out there for listening today, for joining us. Once again, please do take the time to respond to the evaluation you'll receive in your email along with the links to the presentation. Your feedback will help us to continually improve the webinar program. That concludes the webinar for today. I hope you have a great rest of your week. Thank you so much, everyone.
Thank you, Christy. Thank you, Jennifer. And thank you for everyone that attended. I appreciate you being here.
Have a great afternoon.